Thank you very much. It's hard to speak after Dr. McGovern and Janet Smith, but I'll try to keep your attention. I'm going to be talking about intimate partner violence, the poison pill-picking partners, and pheromones. Appreciate the alliteration. So what we're going to talk about is the evidence for intimate partner violence as a significant cause of women seeking trauma care and pregnancy-associated homicide, discuss the factors which lead women to be at increased risk, discuss how female changes in pheromones result in being at greater risk, and learn the pathophysiology of the pheromonal changes that result in these behavioral changes that lead to intimate partner violence. So how did I get interested in this topic? Well, I was asked to give a talk on the 50th anniversary of the pill. And there was a Time magazine cover story celebrating the pill in May of 2010. And what it said about it was so small, so powerful, and so misunderstood. And what they talked about was this study that also came out to celebrate 50 years of the pill. It was in the British Medical Journal in March, and it talked about the mortality among contraceptive pill user, and it was done as a cohort from the Royal College of General Practitioners, and Hannaford was the first author. And what Time magazine said was a large study released found that women who take the pill are less likely to die prematurely from any cause, including cancer, heart disease, but this was not true. If you actually looked at the study, you see in the middle of the abstract, it says the women who took the pill had a higher rate of violent deaths. And what they said in this study was that they got this result, they looked at it from every direction, it was really statistically true, but they didn't know what caused it. So the Time magazine article would have what the Donald calls fake news. So the Hannaford study said that there was an increase, 192%, statistically significant increased risk of violent death among women on the pill. So why did that happen? Well, if you look back at older studies, like this one from the Journal of the Reproductive Medicine in December of 1980, you'll see that under mortality, accidents or violence accounted for almost 19% of the causes of death of women on the pill. So what is the data on violence and the pill? Well, when I was doing research on this, I came across S. Craig Roberts. And at that time, he was an instructor in the School of Biological Sciences at the University of Liverpool. And he had written a rapid response to the Hannaford study that you could find online. And if you looked him up, he had done these studies. In 2008, he did this study where if odor plays a role in human mate choice, our results suggest that the contraceptive pill use could disrupt disassortive mate preferences. And then the next year, in 2009, he authored a review article where he showed factors of special relevance in terms of individual preferences are reproductive status and long versus short-term mating context, odor preference for major histocompatibility dissimilarity. So he wrote this in response to the British Medical Journal Hannaford study. Because Hannaford had said, we found it, it was real, we don't know what caused it. So he wrote, Hannaford found a higher rate of violent death among ever users, and that the rate of violent death increases with longer duration of oral contraceptive use. Evolutionary insights into human partner choice may provide a clue. It is not unreasonable to suspect that such effects could also influence rates of intimate partner violence. This is the most common cause of non-fatal injury among women and accounts for more than a third of the women murdered in the United States. Oral contraception alters women's baseline preferences for men, such that pill users prefer men who are relatively similar to themselves. One consequence of being partnered with similar men is lower sexual responsivity. They reject sexual advances more frequently and have more extra pair bonding. That's how they term it in the sociologic literature. So in other words, if you have an MHC similar couple, they had bad sex, less sex, and more cheating. And you could see where that might lead to violence. And other evidence showed that these couples also had problems in conceiving children, and the children they did have were less healthy due to their lower MHC heterozygosity. So those things had effect on the quality of their spousal relationships. So exactly what are these 8 MHC genes? Well, these are the major histocompatibility genes, the genes they test for when you want to transplant an organ. And there are a group of genes that code for proteins found on the surfaces of cells that help the immune system recognize foreign substances. And they're on everything. The HLA genes, class 1, on all cells in your entire body. Class 2 on the macrophages and lymphocytes, and class 3, the cytokines, enzymes, and complement proteins. So initially defined as antigens that stimulate an organism's immunologic response to transplanted organ tissues, they're very important for the immune system to fight infections. And they also have a role in the autoimmune diseases, multiple sclerosis, type 1 diabetes, SLE, ulcerative colitis, Crohn's disease, and rheumatoid arthritis. And they're on chromosome 6, and those are the little pictures of them I got off the internet. There's an unusually large number of alleles, and it's very rare to have 2 individuals to have the same set of genes. So there's an argument that can be made that there's a selective pressure to maintain a wide variety of these MHC molecules in the population because you want to be able to fight infectious agents. So they're critical to our survival. And until the recent past, with the development of antibiotics in the 1940s, infectious disease was a leading cause of death. Due to the large role of MHC genes in surviving infections, it led to increased survival. So the pill's disruption of this tendency to allow our children to have the greatest mix of these genes that's very protective for them is self-destructive to our survival. So how do they do this? How does the pill make you pick somebody that's similar to you in the major histocompatibility genes? So what are pheromones, and do they occur in humans? So pheromones are chemical compounds produced and secreted by an individual that influences the behavior or development of members of their own species. So that's why fish school and why you can have Japanese beetle traps that are attracting the Japanese beetles to get killed because they figured out the insect pheromones. So in animals, the pheromones are perceived by the vomer nasal organ, the VMO. And although that organ exists and is identifiable in a fetus, it's not readily shown in an adult. However, many recent studies have shown that adult humans react to pheromones. So the pill, as so well described by Janet Smith, has had a tremendous impact on our society. So less than 10 years after the introduction of the pill, in 1972, Lionel Tiger, who's a professor emeritus of anthropology at Rutgers in New Jersey, wrote this book called The Decline of Males. And he wrote about all the social changes that was occurring since the introduction of the pill in male-female relationships. So in that book, he described an experiment that they had done on a macaque troop of monkeys off an isolated island in Bermuda. And what they did was they looked at the effect of a Depo-Provera injection in the females, which is a long-acting progestin contraceptive. And so the first 3 months, they just saw what was happening in the troop. They identified the alpha male, they saw who his consorts were, they saw the relationship between the other monkeys and their mates. The second 3 months, they captured 5 females in the troop, and they gave them a Depo shot, and they saw what happened. And then after the Depo wore off, they captured all of the females and shot them all up with Depro. So what happened? Well, the alpha male was known to have 3 female consorts. He had sex with them, and he groomed them. But 2 of the 5 females that were captured and got Depo the first round were his. He still groomed them, but he didn't have sex with them anymore. And he replaced those with 2 other females to have sex with. So then, at the point in time when all the females of the troop had gotten a shot, this caused the alpha male to, quote, attemperate, masturbate, and behave in a turbulent and confused manner. And I managed to find that picture that expressed how he felt about the experiment. So I had told a resident, family practice residents rotate with the surgeons, and I had to talk to her about oral contraceptives and change in pheromones, and she said, oh, that really makes sense to me, because there's this saying that I started on the pill because I started having sex. Now I'm on the pill and I'm not having sex. And that can, it spoke to her. She didn't have any trouble understanding what I was saying to her. And if you think about our own sayings, that doesn't smell right. When I was a resident, there was a nurse going out with another chief resident that I was friends with, and when they broke up, she told me she had kept a T-shirt of his, and that it was the only thing that she could have that would allow her to sleep anymore, because she held that T-shirt with her when she went to sleep in bed. And I don't know if many of you saw Brokeback Mountain, but after the cowboy's lover got killed, and he went to talk to his lover's parents, he went to his room and took a shirt off the hanger in the closet and put it to his face and inhaled deeply. So there is something about humans where we're doing these things, but they're so unconscious, we're just not aware of them. So what's the data in humans? In the 1970s, McClintock noticed that when women moved into a dormitory, after a certain length of time, it seemed like everybody was getting their period at the same time. So eventually, when she graduated and became a professor and PhD, she went and did a study with Stern, and she took fluid from a female underarms and put it on another female's upper lip. And she could find that she could delay or hasten the onset of that woman's cycle who had been exposed to that fluid from the other woman's armpit. So we've gotten more sophisticated with PET scans and MRIs. In 2001, Savick used PET scans and showed that male pheromones, in this case androstenedione, and the female hormone, that's estrogen-based, affected male and female brains differently. The male compound only stimulated female brains, and the female compound only stimulated male brains. So then, about 7 years later, she broke down the control groups and found that the areas that lit up in the heterosexual females were similar to those in homosexual males, so that they were responding to the same pheromones the same way, and it was true the other way around. Heterosexual males were more similar in their response into what areas of the brain lit up as homosexual women. So in 2003, Seppo found that the most attractive part of the cycle for men is their mid-cycle, their fertile phase. Whereas women on the pill, the men didn't respond to them differently according to their cycle. Then your tax dollars paid for a study of strippers and lap dancers in New Mexico, and they found that the strippers got higher tips during their fertile phase, statistically significant. So what about humans and pheromones? Roberts found that women not taking the pill find men who are most dissimilar to them in MHC genes as most attractive. And so because of that, they avoided the problem of having a partner that was very similar to them in those genes. So they avoided the unstable unions, violence, infertility. So what is the relevance of the pill and the pheromones on human behaviors to our survival? Well, this is what's happening in the United States. According to the CDC, at one point in life, every woman between 18 and 45, any woman of reproductive age has taken the pill at some point. So if these women are getting this sense from men that they're really less attractive, it may explain why fashions have gotten so much more provocative, with lower necklines, higher hems, and more exposed skin, because these women on the pill are sensing that they're losing that attractiveness that men normally would have towards them. Several studies have reported that the leading cause of death in pregnant women is homicide by intimate partners. I mean, don't you always hear it on the radio of some lover that got pregnant and, the sports figure, had a drive-by shooting of the pregnant woman, or the military man, buried her and burnt her in the backyard? All of those reports are really not aberrations. They're what's happening. So a 2001 study published in JAMA revealed that 20% of the women in Maryland who died during pregnancy were murdered. And researchers found that same trend in New York and Chicago, and according to the CDC, approximately 324,000 pregnant women are hurt by an intimate partner or former partner every year. Intimate partner violence is the most common cause of non-fatal injury among women. If you look at emergency room statistics, a third of the women coming into the emergency room with trauma, the trauma has been done by an intimate partner. I remember when I was in medical school, this woman came in and she was all beat up by her boyfriend. And she was saying, oh, I'm going to get that man, I'm going to get him, I'm going to... And sure enough, the next shift, the man comes in and she had hit him with an iron frying pan and really did a lot of damage. So since the introduction of the pill in the 1960s, there's more unstable marriages and divorce, more violence against women, more objectification of women, more abortions, more breast cancer, and a whole host of physical ills, as spoken to by Dr. Janet Smith. So in conclusion, there's evidence of pheromones in humans. There is a dissenting opinion in the literature, and I can't remember his name, but he wrote an extensive piece about it. But I believe that there's good, solid evidence there is. These pheromones are impacted by the pill, and if it's not through pheromones, it's through something else, because we know the pill has a lot of effect on our behaviors. And the changes in male-female pheromones while on the pill result in changes in the major histocompatibility preferences in the choice of a mate, which can lead to unsatisfying sexual unions, violence, and disease in progeny. And every time you get a pregnant woman, you have to remember, you know how they make you screen on that, detestable EMR for all sorts of things? You need to be screening women on the pill and seeing if they're being, abused by their partner. And that pregnant women are at an increased risk of homicide. And then I would personally advise anyone not to get engaged while they're on the pill. So in your blue bags that you got at registration, I put this brochure called The Pill Kills. And it's put out by the Breast Cancer Prevention Institute, and I talk about the 4 ways, which is basically it can cause your blood to clot. So if it clots in your head, it's a stroke, in the heart, an MI, or a pulmonary embolism. It makes it easier to get infections like HPV and HIV. They cause cancer, and they make it more likely you'll die from a violent death. And if you look on the back, 2 of the references are by S.C. Roberts, who is that person that wrote that letter to the editor when the Hannaford study first came out. I also have brochures that you can look at online at our website that are more suitable than this in-your-face brochure about the pill. It's called What Smart Women Should Know Before Choosing the Pill. It's pink, and everything is very non-judgmental in it, so you could hand it to that patient and not be, too embarrassed. If you do choose to talk about these things to your colleagues, you will feel like this. So this is an iconic picture of Saint Sebastian, who was a Roman soldier who used to bring Christians into the Colosseum, to get eaten by the lions. And at one point he said, I really can't do this anymore, and so I'm Christian. So when he said I'm Christian, this was the result. They shot him with a bunch of arrows and threw him in the Tiber. But as things would happen, he survived that attack. And when he was nursed back to health by the Christians that dragged him out, I don't know why he did this, but he went back and said, "Still here, and I am a Christian." So at that point, they chopped his body into pieces before they threw it in the Tiber. So you won't get a warm response to this, but I think that if you're talking to doctors, you know, especially the residents and students who aren't so invested in the pill, you have to remember, when you say anything negative about abortion or anything negative about the pill, you have to realize you're talking to a lot of people who believe in their hearts of hearts that they have done the best that they could do for their patients. When I would talk to doctors about, you know, the abortions that they did, they would say, you know, I saved her life. She was 18, ready to go to college. She got pregnant, and if I hadn't done that abortion, you know, she wouldn't have gone to college and got married and have kids now. I mean, for some reason, they think that if you're pregnant and have a child, that your IQ drops so substantially that you can't go to college anymore. But a lot of people really feel that they are doing the best for their, and you have to remember that your OBGYN colleagues are being taught and nurtured and have as the head of the American Congress of OBGYNs, it used to be college, the abortionist, Dr. David Grimes, who writes textbooks on how to do abortions. So, and you know, so you won't get a good response. But sometimes the response you'll get is, you know, if you talk about the breast cancer aspect with the pills, they'll say, or the abortion aspect. I spoke to a vascular technician about the abortion and the breast cancer. And you also have a pamphlet in your bag that is suitable to educate patients about. She said, you know, my sister-in-law was 26 when she got breast cancer, and she had an abortion when she was 18. And she had nobody in her family with it. So it wasn't one of those premenopausal breast cancers caused by the BRCA gene or something like that. And all these stories will come out. Like when I was at a meeting in 2000 in Miami, where there were 900 doctors in a breast cancer conference with pathologists, radiologists, surgeons, medical oncologists. They would all come out with stories where they had patients with early premenopausal breast cancers and a very strong abortion history. So I don't think that you should let what happened to Saint Sebastian hold you back. So far, you know, they're not pouring tar on our heads and immolating us like the first Christians when they were evangelizing and speaking the truth. So far, we're still allowed to retain our medical license. But in the future, I think it's going to be harder and harder to be a conscientious objector and keep yourselves away from all of this stuff. So that's our website if you want more information. And I guess we have at least 15 minutes to take questions if you have any.
If you have questions, please come up to a microphone, or I'll bring you one.
Hi. I wanted to know, you mentioned before the autoimmune diseases like lupus, RA, all of that, and the fact that the hormone contraceptive changes the immune response. Is there a study on the if there's an association between being on those medications and having those conditions, because those conditions are a lot more common in women?
Right. So there are studies linking things like rheumatoid arthritis to abortion. So when you don't go through the normal physiologic process separating the placenta from the uterine wall, and you're scraping it and you're opening up all those venous channels, there's a lot more fetal cells that get into the mother's circulation. So the fetal cells are foreign, right? So they would create an immune response. So in terms of oral contraceptives and autoimmune disease, no. But I can tell you that I do get a lot of patients, like one of the autoimmune diseases that is not up there is thyroid, like Hashimoto's and things like that. And one of the reasons I became interested in the abortion breast cancer link after I found out about it was I changed my intake form to get a complete reproductive history. I didn't say gravida para AB. I said, how many times were you pregnant? How did each pregnancy end? Was it live birth, stillbirth, miscarriage, abortion? How many weeks did those events happen? And I really found a strong association between abortion and breast cancer in those patients that did have that history. So I can't tell you about the pill and autoimmune disease, but if you think of the oral contraceptive as also acting as an abortifacient, because like the mini pill, 50% of ovulations occur. We know, according to CDC statistics, that 9% of the women on the pill will get pregnant that year that they're on the pill, taking the pill as directed. So we know that they're pregnancies, and if these are all, mini miscarriages because you can't implant the blastocyst, maybe there's more fetal material getting into the mother. 9? Yes, go to the CDC website, look at their section on the effectiveness of different methods of contraceptives. It'll make your head blow up. Because women, every time, a woman gets pregnant with their boyfriend and they're on the pill, the boyfriend always suspects the woman. And they're always blaming teenagers for not being compliant with the pill. But teenagers are so fertile, they can smell sperm and get pregnant. So it's not the woman's fault. It's because they don't work all the time. And women don't know that. They think that they're 100% effective. Yes?
So just to follow up on that last point, there's an article that was just published in the Lineker this time around on the effect of contraceptives on autoimmune disease.
Oh, I didn't know that.
Yeah, and clearly increase in Crohn's disease, increased ulcerative colitis, increased lupus, probably increase MS and a few other things, decrease in thyroid disease, but clearly there's an effect there. And it's probably partially related to the estrogens, which are pro-inflammatory. And also, and then the abortion thing you mentioned, the microchimerism, that's another interesting observation. So.
Yeah. Yes.
Is that?
Yeah.
So that's on. Yes. Thank you very much for a very, very informative talk. I was struck by your comments about the reaction of our colleagues when faced with a criticism about contraception, abortion, or any other number of things that they might be practicing, and about your comment that they feel often sincerely that they're doing a good thing. And I just wanted to comment. This is a book by Bishop Barron, and he cites another author, John Shea, and he says that when we criticize someone, we should criticize them precisely in the measure that we're willing to help them deal with the issue or the problem that we're criticizing, which is another challenge to us then when speaking to our colleagues, not just in terms of getting into an argument and winning an argument, but I was struck by, you raised the fact that we're really challenging deeply held and illusory or wrong convictions that have led to practices in their professional life, maybe in their personal life. But if we just tell them that it's wrong and we aren't willing to step out there with them and try to find a solution, then we're not doing enough, and it's just a challenge to us.
I will tell you that people at the top know the truth. So when the Breast Cancer Prevention Institute in 2000 asked to have a table at the Miami Breast Cancer Conference, we sent them our check, and they said, okay, you have a table. We were going to put out our literature. And then my partner said, we really don't have that much money. Let's see if we can get it cheaper. I'm going to call them. I said, do not do that. Do not do that. But he did. And Dr. Osmond said, well, exactly what do you do? And he said what we did. And the next thing you know, they ran out of tables and sent back our check, even though the day of the conference, there were little notices on our seats saying that new educational conference tables were open. So I went up to Dr. Osmond, and I said, why did you do that? And he goes, I'll let you ask a question at this lecture. I said, okay. And then he didn't let me ask the question. So then I went up to him, and I said, do you know about Semmelweis? And if people in this room don't know about Semmelweis, in the 1840s, he was a Jew, not very popular, and wanted to be the best doctor he could, so he went to Vienna where the German doctors were practicing the best OB-GYN in the world, and he noticed something, that the women on the doctor's floor, 30% of them died of puerperal fever. And on the midwife's floor, it was only 2 to 3%. So he made some observations that the midwives were always washing their hands because they didn't have latex gloves. But the doctors would go from the autopsy room, have, quote, odor particles on their hand, and then go down the ward serially doing vaginal exams. He notices the ones they did the exams on first were more likely to die. And this was before the germ theory. So he pointed it out to them, and they said, it's because we have the medical students. They scare the patients. That's why they're getting this disease. And, it's the anesthesiologist. All the surgeons know that. So finally, they let him do a study where they would dip their hands into hypochlorite solution, which is basically Clorox, and then the mortality rate went down to the midwives' rate. So women were living and not dying. And instead of saying, good job, good on you, mate, they drummed him out of town. So he goes back to Budapest, and he comes out with the treatise on hand washing and puerperal fever and gets laughed out of the Paris Medical Society and stuff like that. He gets burnout. He gets so depressed, he ends up in a mental hospital and he's dead shortly. So I said to the guy that was running this cancer conference, Dr. Osmond, I said, do you know the story of Semmelweis? And he's a Jew, so of course he knows it. And he goes, yes. And I said, don't you know that abortion causes breast cancer? And he goes, yes. So now I've got tears in my eyes. And then I said, why don't you let us do a 15-minute, pro-sentinel node, anti-sentinel node, it is a risk factor for breast cancer. It isn't a risk factor. Why don't you let us do that? And he goes, it's too political. And I said, is it going to be too political after the Gore-Bush elections? When can we talk about this? Every single person, all the Harvard professors, 2 of them I can name, know that abortion is a risk factor for breast cancer and meets the epidemiological literature, meet the Bradford Hill criteria for causality. So the people up there, look what happened to Nancy Davidson, who's a very well-respected researcher in breast cancer. She wrote in the New England Journal of Medicine that estrogen was a cause of carcinogenesis. And the next letters to the editor in the next issue, just slayed her. How could you say that? You came out with this other study that didn't say that. And she goes, yes, I changed my mind. So here she's a big person, and she's getting slammed. So you can imagine if someone like me, a little nobody, or somebody who's not up there in academic rank talks about this stuff. You had one question? Oh, you took it away?
We're into the break right now, so
sorry.
thank you. I think she deserves a great round of applause.